Right now, at this very moment, while you're watching this video, approximately 280 million people around the world are living with depression. That's more than the entire population of Indonesia. And here's the terrifying part: every 40 seconds, someone loses their battle with this invisible enemy and takes their own life. But here's what makes me angry as a physician: we're living in an era where we can send robots to Mars, where we can edit human genes, where we can create artificial intelligence that beats chess grandmasters, yet we're losing nearly 700,000 people every year to a condition that is treatable. Let that sink in. Treatable. I'm Dr. Hannah, and today we're going to talk about something that has been stigmatized, misunderstood, and frankly, ignored for far too long. We're diving deep into depression, not the kind where you feel sad because your favorite show got cancelled, although I do feel you on that one, but the real, clinical depression that hijacks your brain chemistry and makes even getting out of bed feel like climbing Mount Everest. By the end of this video, you're going to understand what depression really is, how it literally changes your brain, why some people are more vulnerable than others, and most importantly, what actually works to treat it. Because knowledge isn't just power, it's survival. Let's begin. So, what exactly is depression? And no, it's not just being sad because it's Monday again, although Mondays do have their own special place in hell, don't they? Clinical depression, which we doctors call Major Depressive Disorder or MDD, is a serious mental health condition that affects how you feel, think, and handle daily activities. But here's what most people don't realize: depression is not a weakness. It's not a character flaw. It's not something you can just snap out of any more than you can snap out of diabetes or a broken leg. Depression is a medical condition with biological, psychological, and social components. When you have depression, the levels of neurotransmitters in your brain, specifically serotonin, norepinephrine, and dopamine, become imbalanced. Think of these neurotransmitters as the postal service of your brain. They deliver messages between nerve cells. When this system breaks down, the messages don't get delivered properly, and that's when everything starts falling apart. Let me paint you a picture of what depression actually looks like. Imagine waking up and feeling absolutely nothing. Not sad, not happy, just empty. It's like someone took an eraser and wiped away all the colors from your life, leaving everything in shades of gray. You look at things that used to bring you joy, your favorite food, your hobbies, even your loved ones, and you feel absolutely nothing. That's anhedonia, the inability to feel pleasure, and it's one of the hallmark symptoms of depression. But it gets worse. Your brain starts lying to you. It tells you that you're worthless, that nobody cares about you, that the world would be better off without you. And the scariest part? These thoughts feel absolutely true when you're in the depths of depression. That's why it's so dangerous. Now, let me hit you with some numbers that should make everyone sit up and pay attention. Depression is the leading cause of disability worldwide. According to the World Health Organization, over 280 million people suffer from depression globally. That's roughly 3.8% of the entire human population. But here's the kicker: these are just the diagnosed cases. Experts estimate that the actual number could be twice as high because so many people never seek help due to stigma or lack of access to mental health care. Women are nearly twice as likely to experience depression compared to men. Before you guys start celebrating, hold on, because men are actually 4 times more likely to die by suicide. Why? Because men are often socialized to hide their emotions, to man up, to not show weakness. And that toxic masculinity is literally killing people. The economic impact? Depression costs the global economy approximately $1 trillion per year in lost productivity. $1 trillion. That's more than the GDP of most countries. And yet, in many places around the world, mental health receives less than 2% of healthcare budgets. The math isn't matching, folks. Here's another terrifying statistic: up to 60% of people who die by suicide had a mood disorder like depression. And get this, only about half of people with depression ever receive treatment. Half. That means millions of people are suffering in silence, believing that this is just how life is supposed to feel. So how do you know if you or someone you love has depression? Let me break down the symptoms for you, and I want you to pay close attention because recognizing these signs early can literally save lives. To be diagnosed with major depressive disorder, you need to have at least 5 of the following symptoms for at least 2 weeks, and at least one of them must be either depressed mood or loss of interest or pleasure. First, persistent sadness or emptiness. This isn't feeling down for a day or two. This is a heavy, suffocating feeling that follows you everywhere, every single day. Second, loss of interest in activities you used to enjoy. Remember that hobby you loved? That TV show you couldn't wait to watch? Suddenly, they mean nothing to you. Food loses its taste. Music sounds like noise. Nothing brings you joy anymore. Third, significant changes in weight or appetite. Some people can't eat at all, while others eat compulsively. You might lose 10, 20, even 30 pounds without trying, or you might gain that much. Your body is responding to the chaos in your brain. Fourth, sleep disturbances. This can go either way. Some people with depression sleep 12, 14, even 16 hours a day and still feel exhausted. Others can't sleep at all, lying awake at 3 a.m. with their thoughts racing in circles like a hamster on a wheel from hell. Fifth, psychomotor changes. Either you're moving in slow motion like you're underwater, or you're agitated and restless, unable to sit still. Both are signs that something is seriously wrong. Sixth, fatigue or loss of energy. We're not talking about being tired after a long day. This is bone-deep exhaustion that doesn't improve with rest. Getting up to brush your teeth feels like running a marathon. Seventh, feelings of worthlessness or excessive guilt. Your brain becomes a bully, constantly telling you how terrible you are, how you've ruined everything, how every bad thing is your fault. These thoughts are persistent, intrusive, and devastating. Eighth, difficulty concentrating or making decisions. Depression literally affects your cognitive function. You can't focus on conversations, you can't remember simple things, and even deciding what to eat for breakfast feels overwhelming. Ninth, and this is the most critical one, recurrent thoughts of death or suicide. If you or someone you know is experiencing this, please reach out for help immediately. Call a suicide hotline, go to the emergency room, tell someone you trust. This is not something to tough out alone. Now, I know some of you are thinking, well, I've experienced some of these symptoms. Does that mean I have depression? Not necessarily. The key factors are the duration, at least 2 weeks, the number of symptoms, at least 5, and the severity. These symptoms must significantly interfere with your daily functioning. So what causes depression? Well, if I had a simple answer to that question, I'd probably be collecting my Nobel Prize right now. The truth is, depression is complex, and it usually results from a combination of factors. Let's start with biology. Some people are genetically predisposed to depression. If you have a first-degree relative with depression, you're about 2 to 3 times more likely to develop it yourself. Scientists have identified several genes that may increase vulnerability to depression, but it's not as simple as having a depression gene. It's more like having a loaded gun that environmental factors can trigger. Your brain chemistry plays a huge role. Remember those neurotransmitters I mentioned? Serotonin, norepinephrine, and dopamine? When these are out of balance, depression can develop. But here's where it gets interesting. We still don't fully understand whether the chemical imbalance causes depression or if depression causes the chemical imbalance. It's probably a bit of both, feeding into each other in a vicious cycle. Then there's brain structure. Modern neuroimaging studies have shown that people with depression often have changes in certain areas of the brain, particularly the hippocampus, which tends to be smaller. The hippocampus is crucial for memory and emotion regulation. It's like depression physically reshapes your brain, which explains why it's so hard to just think positive your way out of it. Hormones are another major player. Thyroid problems, changes in reproductive hormones during pregnancy or menopause, and chronic stress that elevates cortisol levels can all contribute to depression. Your endocrine system and your mood are intimately connected. Now let's talk about psychological factors. Trauma, especially in childhood, significantly increases the risk of depression later in life. We're talking about abuse, neglect, loss of a parent, or other significant adverse experiences. These experiences can literally alter your brain development and your stress response system. Personality traits also matter. People who are prone to negative thinking, have low self-esteem, or feel they have little control over their lives are more vulnerable to depression. But, and this is important, this doesn't mean it's their fault. These traits often develop as a result of early experiences and biology. Social factors are huge too. Chronic stress, poverty, unemployment, social isolation, discrimination, and lack of social support all increase depression risk. We're social creatures, and when our social environment is toxic or absent, we suffer. And let's be real, if you're working 3 jobs just to pay rent, living paycheck to paycheck, and never seeing your family, of course you're at higher risk for depression. Society has a role to play here. Medical conditions can also trigger depression. Chronic pain, cancer, heart disease, diabetes, Parkinson's disease, and many other conditions are associated with higher rates of depression. Sometimes it's the stress of dealing with the illness, and sometimes it's direct biological effects of the disease on the brain. And here's something that doesn't get talked about enough: certain medications can cause depression as a side effect. Beta blockers, corticosteroids, some hormonal contraceptives, and even some acne medications can trigger depressive symptoms in susceptible individuals. Finally, substance abuse and depression often go hand in hand. People with depression may turn to alcohol or drugs to self-medicate, which then makes the depression worse, creating a downward spiral. It's like trying to put out a fire with gasoline. Let's take a quick journey through history because understanding where we've been helps us appreciate where we are now. Depression has been recognized since ancient times. Hippocrates, the father of medicine, described melancholia around 400 BCE, attributing it to an imbalance of bodily fluids, particularly black bile. Wrong mechanism, but he was onto something by recognizing it as a medical condition. Throughout the Middle Ages, depression was often attributed to demonic possession or moral failing. People with mental illness were locked away in asylums, subjected to horrific treatments, or worse. Dark times, literally and figuratively. The 20th century brought both progress and horror. Sigmund Freud suggested depression resulted from anger turned inward, while others tried treatments like insulin shock therapy or prefrontal lobotomies. Yes, they literally cut pieces out of people's brains. The lobotomy's inventor, Antonio Egas Moniz, won the Nobel Prize in 1949. They gave him a Nobel Prize for that. Let that sink in. The real breakthrough came in the 1950s with the accidental discovery of antidepressants. Scientists noticed that a tuberculosis drug called iproniazid made patients happy and energetic. This led to the development of the first antidepressants, the MAO inhibitors. Then in the 1980s and 90s, SSRIs, selective serotonin reuptake inhibitors, like Prozac revolutionized treatment. Suddenly, millions of people had access to medications that could help with fewer side effects than the older drugs. Today, we have multiple classes of antidepressants, various types of psychotherapy proven to work, brain stimulation techniques, and a growing understanding of the neurobiology of depression. We've come a long way from drilling holes in people's heads to let out evil spirits, though some days it doesn't feel like we've progressed enough. Depression doesn't discriminate. It doesn't care if you're rich or poor, famous or unknown, successful or struggling. Let me tell you about some famous individuals who have battled depression, because sometimes knowing you're not alone makes all the difference. Abraham Lincoln, one of America's greatest presidents, suffered from severe depression throughout his life. He once said, "I am now the most miserable man living." And yet, he led the country through its darkest period and abolished slavery. Winston Churchill called his depression the black dog that followed him throughout his life. The man who inspired a nation during World War II was fighting his own private war inside his head. Virginia Woolf, the brilliant writer, struggled with bipolar disorder and severe depression. She eventually took her own life in 1941, leaving a note that said, "I don't think two people could have been happier than we have been." More recently, Robin Williams, who made millions laugh, was fighting a devastating battle with depression and Lewy body dementia. His death in 2014 shocked the world and sparked important conversations about mental health. Dwayne "The Rock" Johnson has openly discussed his experience with depression after his mother's suicide attempt and his own career setbacks. Here's a man who seems to have it all: success, money, fame, and he still fought depression. Lady Gaga, Kristen Bell, Dwayne "The Rock" Johnson, Demi Lovato, and many other celebrities have spoken publicly about their struggles with depression. Their openness has helped reduce stigma and encouraged others to seek help. The point is this: depression can affect anyone. It's not a sign of weakness. Some of history's most accomplished, talented, and beloved individuals have fought this battle. And many have won. Now for the most important part: treatment. Because here's the truth: depression is highly treatable, and most people who get proper treatment do get better. Let's start with psychotherapy, also known as talk therapy. And no, it's not just lying on a couch complaining about your mother, though if that's what you need, no judgment here. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for depression. It's based on the idea that our thoughts, feelings, and behaviors are all connected. CBT helps you identify negative thought patterns and replace them with more realistic, helpful ones. It gives you practical tools to manage symptoms. Typical treatment lasts 12 to 20 sessions, and research shows it's as effective as medication for many people. Interpersonal therapy, or IPT, focuses on improving your relationships and how you relate to others. It's based on the idea that our relationships significantly impact our mental health. This therapy typically lasts 12 to 16 sessions. Psychodynamic therapy explores how unconscious thoughts and past experiences, particularly from childhood, influence your current behavior and feelings. This one tends to be longer term. Now, let's talk about medication. Antidepressants work by affecting neurotransmitter levels in the brain. There are several classes. SSRIs, selective serotonin reuptake inhibitors, are usually the first-line treatment. These include fluoxetine, which you know as Prozac, sertraline, which is Zoloft, and others. They work by increasing serotonin levels in the brain. Side effects can include nausea, insomnia, sexual dysfunction, and weight gain, but many people tolerate them well. SNRIs, serotonin norepinephrine reuptake inhibitors, like venlafaxine, which is Effexor, affect both serotonin and norepinephrine. They're often used when SSRIs don't work. Atypical antidepressants like bupropion, which is Wellbutrin, work differently and might be better for people who can't tolerate SSRIs or SNRIs. Older medications like tricyclic antidepressants and MAO inhibitors are still used when newer medications don't work, though they tend to have more side effects. Here's something crucial: antidepressants take time to work. You won't feel better overnight or even after a week. It typically takes 4 to 6 weeks to see significant improvement. And finding the right medication and dose often requires trial and error. Don't give up if the first one doesn't work. For severe, treatment-resistant depression, there are other options. Electroconvulsive therapy, or ECT, has come a long way from the horrifying portrayals in movies. Modern ECT is done under anesthesia and is actually very effective for severe depression, with response rates of 70 to 90%. Transcranial magnetic stimulation, or TMS, uses magnetic pulses to stimulate specific areas of the brain. It's non-invasive and has fewer side effects than ECT. Ketamine and esketamine are newer treatments showing promise for treatment-resistant depression, working rapidly, sometimes within hours rather than weeks. Now, let's talk about natural approaches and lifestyle changes. And I need to be very clear here: for mild to moderate depression, these can be incredibly helpful. For severe depression, these should complement, not replace, professional treatment. Exercise is one of the most powerful natural antidepressants. Regular physical activity increases endorphins, improves sleep, reduces stress, and can be as effective as medication for mild to moderate depression. We're talking about 30 minutes of moderate exercise most days of the week. You don't need to run marathons, a brisk walk counts. Nutrition matters more than you might think. Your gut and your brain are intimately connected through what we call the gut-brain axis. A diet rich in omega-3 fatty acids, found in fish, walnuts, and flax seeds, complex carbohydrates, lean proteins, and plenty of fruits and vegetables can help stabilize mood. The Mediterranean diet has been associated with lower rates of depression. Speaking of the gut, probiotics and a healthy gut microbiome may play a role in mental health. Emerging research suggests that gut bacteria can influence mood and behavior. Fermented foods like yogurt, kefir, and sauerkraut can help. Sleep hygiene is absolutely critical. Poor sleep can trigger or worsen depression, and depression can cause sleep problems. It's a vicious cycle. Aim for 7 to 9 hours per night, keep a consistent sleep schedule, and create a relaxing bedtime routine. Light therapy can be incredibly effective, especially for seasonal affective disorder. Exposure to bright light, especially in the morning, can help regulate your circadian rhythm and improve mood. Mindfulness and meditation have substantial evidence supporting their use in depression. Regular meditation can actually change brain structure, increasing gray matter in areas associated with emotion regulation. Social connection is not optional for human beings. We need meaningful relationships. Even when depression makes you want to isolate, maintaining social connections is crucial. Join a support group, reach out to friends, volunteer, anything to stay connected to other humans. Supplements that may help include omega-3 fatty acids, particularly EPA, SAMe, which is S-adenosylL-methionine, St. John's wort, though this can interact with many medications, so talk to your doctor first. Vitamin D, especially if you're deficient, and B-complex vitamins. However, and I cannot stress this enough, always consult with a healthcare provider before starting any supplements, especially if you're taking medications. Natural doesn't always mean safe, and interactions can be dangerous. Now let's talk about what you should absolutely not do if you or someone you love has depression. Don't tell someone with depression to just snap out of it or think positive. Would you tell someone with a broken leg to just walk it off? No? Then don't do the emotional equivalent. Don't dismiss it as weakness or laziness. Depression is a medical condition, not a character flaw. Don't isolate yourself or let the depressed person completely withdraw. I know it's tempting to hide when you feel like this, but isolation makes depression worse. Don't turn to alcohol or drugs to cope. I get it, you want relief, but substances will only make things worse in the long run. They interfere with medications and therapy and can trigger a downward spiral. Don't ignore thoughts of suicide or self-harm. If you or someone you know is having these thoughts, get help immediately. This is not something to handle alone. Don't stop taking medication suddenly without talking to your doctor. Many antidepressants cause withdrawal symptoms if you stop abruptly. Always work with your healthcare provider to safely discontinue medications. Don't compare your depression to someone else's situation. Other people have it worse doesn't help and actually makes people feel guilty for struggling. Don't expect instant results from treatment. Depression took time to develop, and it takes time to treat. Be patient with the process. Don't make major life decisions while in the depths of depression. Your judgment is impaired when you're severely depressed. Wait until you're thinking more clearly. So what should you do? Let me give you a practical action plan. First and foremost, seek professional help. See a mental health professional, a psychiatrist, psychologist, or therapist who specializes in mood disorders. If you don't know where to start, talk to your primary care doctor. Be honest with your healthcare provider about your symptoms. Don't minimize what you're experiencing. They need the full picture to help you effectively. If you're prescribed medication, take it as directed. Don't skip doses, and don't stop taking it because you feel better. Work with your doctor on any changes. Engage in therapy actively. Therapy isn't passive, you have to do the work. Complete homework assignments, practice the skills you learn, and be open and honest in sessions. Create a crisis plan. Know who to call and where to go if you're in crisis. Keep suicide hotline numbers saved in your phone. In the US, the National Suicide Prevention Lifeline is 988. Maintain a routine. Depression thrives in chaos. Having a daily structure, even a simple one, can provide stability and a sense of control. Set small, achievable goals. Don't try to climb the whole mountain in one day. Maybe today's goal is just taking a shower. That's okay. Small victories add up. Practice self-compassion. Be as kind to yourself as you would be to a good friend going through the same thing. Stay connected to support systems. Let trusted friends and family know what you're going through. You don't have to suffer in silence. Track your symptoms and mood. Keep a journal or use a mood tracking app. This helps you and your healthcare provider identify patterns and assess whether treatments are working. Educate yourself about depression, which you're doing right now by watching this video. Understanding what you're dealing with reduces fear and helps you make informed decisions. So what do you do after you start feeling better? Because here's the thing, depression can be recurrent. About half of people who have one episode of depression will have another at some point in their lives. Continue treatment even after symptoms improve. Many people make the mistake of stopping therapy or medication as soon as they feel better, but completing the full course of treatment reduces the risk of relapse. Develop a maintenance plan with your healthcare provider. This might include ongoing therapy sessions, continuing medication, or both. Know your warning signs. What symptoms appear first when you're starting to slide? Maybe it's changes in sleep, or losing interest in activities, or negative thinking increasing. Recognizing these early signs allows you to intervene quickly. Practice relapse prevention strategies. Use the skills you learned in therapy regularly, not just when you're in crisis. Think of them as mental health hygiene, just like brushing your teeth. Maintain healthy lifestyle habits. Keep exercising, eating well, sleeping regularly, and staying socially connected. These aren't just treatment, they're prevention. Reduce stress where possible. Chronic stress is a major risk factor for depression recurrence. Learn and practice stress management techniques. Build a strong support network. Having people you can talk to and lean on is crucial for long-term mental health. Consider long-term therapy or medication. For some people, especially those with recurrent depression, continuing treatment indefinitely is the best strategy. There's no shame in that. If you had diabetes, you'd take insulin for life. Mental health is no different. Before we wrap up, let's talk about how depression affects your physical health, because it's not just in your head. Depression is associated with chronic inflammation. Blood tests often show elevated levels of inflammatory markers like C-reactive protein and interleukin-6. This inflammation may explain why depression increases the risk of other diseases. Depression increases the risk of cardiovascular disease. People with depression are twice as likely to develop heart disease and have a 65% higher risk of dying from cardiovascular causes. It affects your immune system, making you more susceptible to infections and illness. That's why depressed people often get sick more frequently. Depression is associated with chronic pain conditions. Fibromyalgia, migraines, back pain, and other chronic pain syndromes are more common in people with depression. Blood tests in depression might show changes in cortisol levels, thyroid hormones, and inflammatory markers. Some doctors are researching whether blood tests could eventually help diagnose or monitor depression. Depression accelerates aging at a cellular level. Studies have found that people with depression have shorter telomeres, the protective caps on the ends of chromosomes that naturally shorten as we age. It increases the risk of developing diabetes, worsens outcomes if you already have diabetes, and is associated with obesity and metabolic syndrome. The point is this: depression is not just a mental health issue. It's a whole-body condition that requires whole-body treatment. We've covered a lot today, and I know some of it has been heavy. But I want to leave you with hope because here's the truth that I need you to hear. Depression is treatable, recovery is possible, and millions of people have walked through the darkness and come out the other side. Yes, depression is a serious illness. Yes, it can be life-threatening. But with proper treatment, about 80 to 90% of people with depression respond well. That means the vast majority of people who seek help do get better. The biggest tragedy isn't depression itself, it's the stigma and silence that prevent people from getting help. It's the person suffering alone in their bedroom, believing they're the only one who feels this way. It's the person who's terrified to tell their family because they'll be seen as weak. It's the person who dies by suicide when effective treatments were available. If you're struggling with depression right now, please hear me, you are not weak. You are not broken. You are not alone. What you're feeling is the result of biology, chemistry, and circumstances beyond your control. It's not your fault, and you deserve help and support. Reach out. Talk to someone. See a professional. Try therapy. Consider medication if recommended. Use the coping strategies we've discussed. Give treatment time to work. Don't give up, especially on days when giving up feels like the only option. And if someone you love is struggling with depression, be patient. Be supportive. Listen without judgment. Encourage them to seek help, but don't force it. Let them know you care and you're there for them. Sometimes just sitting with someone in their pain, not trying to fix it but just being present, is the most powerful thing you can do.